Oh my Lord.
Found it.
There you go, right there. Excellent.
What'd you find?
The green.
You sure did.
5 iron to the green. Good afternoon. My name's Troy Mosely. I'm here today to talk to you about playing a little golf here at Cane Creek. The reason that's an important issue to me is 4 months ago it was almost virtually physically impossible for me to do this. I've suffered for the last several years with a disease called peripheral arterial disease. The disease had progressed to a point to where my cardiologist and a vascular surgeon, as well as my general care doctor, had all decided that what I was looking at most likely was an amputation to my right leg, followed not long thereafter by the loss of the left leg. Amputations taking place from the knee down. Prior to the disease getting to this point, I'd already researched every avenue for care and relief that I could, searching the internet. So I went through bypass surgery on both legs back in 2006. One of those left leg bypasses failed within 3 months of the procedure and was redone. I was informed at that time that they'd never be able to do another bypass on that leg. So that again was the possibility of an amputation to the left leg. And 3 months ago, I was scheduled to go for a procedure with my cardiologist. He was going to orthoscopically go back into my legs for another look just to see if there was anything possible he could do. But after being informed that my right leg was already dead for the most part, I had no feeling in my foot and it was constant pain. I had pretty much had myself psychologically geared for the fact that I was going to lose the right leg. I don't know if it was divine intervention, providence, or whatever you might want to call it. The night before I was scheduled to go in for the procedure, we had a little snowstorm here in Anniston, and the hospital called and asked if they could delay the procedure for a week. We agreed to do that, and then the Thursday night before I was scheduled to go into the procedure the following Friday, my wife happened to be watching a program on television, and she caught the very end of the I don't know if it was an infomercial, a commercial, a documentary, but they were talking about a new procedure for the treatment of PAD. The only thing that she actually caught was what the procedure was called, and it was called cool laser surgery. So she typed in on the internet that search word, and up popped Birmingham Heart Clinic in Birmingham, Alabama, with the physician that was in charge of the program being Dr. Foster. So the following morning we called Dr. Foster's office, scheduled an appointment for me to be seen by him, and of course we canceled the procedure that I had scheduled here locally until we could check this out. About a week later, Dr. Foster had me in his office and ran some tests on me, scheduled me for an MRI to be done down at St. Vincent's East in Birmingham. He reviewed the MRI, and the first thing he told me is, "Mosely, I think we can help you." Well, I'm an old retired soldier. I did 20 years service in the Army, working in the military police corps, and I wasn't thinking about losing either of my appendages without going through every possible thing I could. A week later, Dr. Foster had me up, and his team had me on their table down at St. Vincent's East, and I watched as they performed the procedure, opening up the arteries in my legs. They bypassed the original the bypass that was done in 2006 and opened up my own arteries again. I immediately felt warmth in my right foot, my right leg, and that procedure was done on Thursday. On Friday, he went in and done the left leg with the same results. I immediately felt relief. I had severe neuropathy in my right foot. At this time, I still have some neuropathy in my toes in the right foot, but for the most part, I have complete use of both legs, both feet, and I can play golf without any restrictions within a week after the procedure was done. In fact, the following Thursday, when I was released on Saturday, following Thursday, my friend and I were out here on this very golf course, and I was playing golf again.
Now, we just finished playing 9 holes.
9 holes, about to start the back 9 now, and I've had absolutely no discomfort. The reason that I agreed to do this interview at all is I know there's many, many people that are going through the same emotional stress, facing the same decisions about possible amputations, that are completely unaware of this procedure. The work that Dr. Foster and his team is doing in Birmingham is saving limbs, not just from people with peripheral arterial disease, but from people who suffer from diabetic blockages in their legs. There is relief there, and it's not as drastic as you think it may be. The procedure was completely painless. The care I received was excellent. It was an overnight stay for the procedure, had I not had to have both legs done. And this thing can save people lives, that can save limbs. And anything I can do to get this procedure out there, to make people aware of it. Physicians aren't aware of it. My general practitioner, I made sure that he got the paperwork, the procedures of what Dr. Foster and his team did, so he could talk to people when they come in to see him about this. From what I understand, it's relatively new, and I can understand why physicians aren't necessarily aware of it. But we all put total faith and trust in our physicians, and rightly so to a degree. But they don't know everything, and they're not up to date on everything that's possibly available to give you relief. This thing is great, and people need to know about it.
The alternative for you was losing both of your legs.
Losing both of my legs with prosthesis.